Stop scrolling if your pet is struggling with pain.
In this episode, we'll learn how Tony Sherry, Emmett, and red light therapy can possibly help heal them faster and often drug-free.
So let's dive in and let us know what you think in the comments.
And she went, I can't believe it. Wait till I see my mother.
Confiscate
Burnt
our spoon.
that spoon's in the fire now. Gosh. Hello and welcome. Today we're going to talk to Tony Sherry, who is here.
Thank you.
Hello, Tony. So
Good
thanks
afternoon.
for coming in. Tell us all about yourself, how and why you got into the Emmett and also red light therapies.
So in 2011, I had a fall from a horse and broke my back. And I was on lots of morphine and walking around on a Zimmer frame. And I was allowed to have physiotherapy to help me.
Yeah.
And the physiotherapist couldn't do anything because my back was in spasm the whole time. So I started on a journey into complementary therapies to find out what could help. One GP said to me I was over the age of 40, so I'd have to learn to live with the pain. Acupuncture really helped.
Yeah.
That got rid of the spasm, but there was a deep rooted burning pain. So I went on a journey with testing lots of different therapies out.
Yeah.
Came across the Emmett technique and I thought, what a load of rubbish. Light finger, hardly touch the body, treat anybody anywhere, instantly fit, no, on. And I came back to it a few weeks later and there was a horse course for the first time in the UK. And the instructors had been flown over from Australia to teach it. And I felt interested because I thought you can't get a placebo effect on an animal. So if I saw something change, it would be the intervention.
Yeah.
And I went along and on the first day, all the owners of the horses were there because they wanted to see this new therapy being done on their babies. As I approached the mare that they gave me to work on, she turned round and she started showing me her teeth and then she started lifting her hip. And I thought, oh, I'm going to get kicked or bitten in a minute.
Yeah.
And whatever happened, it didn't hurt.
Yeah.
And I touched the horse, said hello, did the first move, and she started licking my arm. And the owner walked off. And I said to the owner a little while later, what happened? Why didn't you stay and watch? And she said, I've had her for 10 years. She's never done that to me. So I knew that there was something in it. And that really started the whole journey into complementary therapies.
Right. And what about the red light technique?
So the red light technique has come along quite recently and there's a lot of scientific evidence into it. It's CE marked for safety reasons in the UK. There's one particular model that is being promoted by the Royal College of Veterinary Surgeons. There's also stuff that's being used within the NHS and it seems to be able to penetrate the skin and recharge cells.
Right. That's interesting.
So that goes along really nicely with my other stuff.
Yeah, absolutely. So can you try and explain to us what the Emmett technique is? Because obviously I've seen you in action and we have you in the shop, don't we? And but when I try to explain it to people,
It's very hard to,
it's very difficult.
Yeah.
So if you could try and explain how it works to people.
So by touching a muscle or tissue really lightly interacts with the subconscious and you're pressing like a reset button.
Right. Okay.
So there's a factory reset and if you then press that in the right way, the right time, with the right pressure, it just instantly relaxes. Right. That's all it is.
Okay, that's quite...
It sounds simple.
Okay, so why does that differ then from massage, physiotherapy or chiropractors then?
So lots of other therapies around use firm pressure. And for instance, when I broke my back, I tried osteopathy and I would lay on the bed completely tense. And I thought, how's it going to work then if I'm like this? With light touch techniques, you seem to be able to relax the body much quicker. So the subconscious is in control. That's what's holding you like that. And if you can gently ask it to relax, it seems to do that. Whereas if you're going in with firm pressure, the body clams up.
Right. Okay, thank you very much for explaining that. Actually, it makes it a lot easier.
How do dogs typically respond during treatment?
So the first time I treat a dog, I normally say to the owner, watch the dog's face. They're going to give you an odd look in a minute. And within a few seconds, the owners go, oh my God, because there's just this instant look of relaxation in the face. And some dogs look at you as if to say, it's about time. And so owners notice a body and the dog reacting straight away.
Can puppies and senior dogs be treated?
Puppies go through a growth spurt and sometimes they can be really uncomfortable. In children, it's known, we go through growth pains and stuff like that. And that's really quite painful. And so with an animal, they can go up one end, then up the other. And that puts a lot of stress and strain on the body. So you can help relieve that. And then for older dogs, as we get older, we all turn into Victor Meldrew because our bodies are getting tighter. And you can relax that and just make them feel more comfortable. So it's a better quality of life at both ends of the scale.
Right, okay. Any particular breeds that respond better than others?
No, they all respond. And sometimes you can go in to treat a dog and you can just see that the way that they come up to you, that's the bit they want you to work on. Yeah. And some dogs, then you do something and then they'll just walk away saying, thank you, I've had enough. Right. And they're all the same.
What kind of physical problems can Emmett help?
Anything to do with muscles or tendons or ligaments. And if you go along with that, sometimes we can hold emotional baggage in our muscles. So if you can relax a muscle and relax a body, it changes mental health.
So, and I suppose that would be anxiety in dogs as well.
Bereavement. Dogs can go through a bereavement process.
We know about that.
We do indeed. Yeah.
So what, have you seen any success post-surgery?
Oh, yeah.
Yeah?
Yes, with red light or with the Emmett, if you relax the tissue around it, then there's a change in circulation and healing happens quicker.
What are the subtle signs that a dog could be uncomfortable or in pain?
People often miss things because they just think, that the dog's getting older and they're slowing down. And sometimes a dog can try and tell you that they're uncomfortable by showing you what's going on. And if you miss it, then their behaviour changes. So you can get a gradual change in behaviour. You can see the odd limp when they get up. You can see that they're sometimes stiff after they've been laying down for a while and they like stretching. To us, it's subtle, but to another dog, it's like semaphore and they're shouting out and we're just not listening.
Yeah, I suppose that's true in a lot of it, I suppose, really, isn't it? We don't understand that.
No.
We don't look out for the signs, do we? Don't know the signs.
It could just be an ear that goes in a certain way at a certain time, or you're stroking them and there might just be a slight reaction.
Any cases where Emmett didn't work as expected? Any failures?
I've never had a failure yet. Okay. I've had an unexpected result on an Akita who I treated him in the owner's garden. And he was very happy afterwards and very playful, and the owners were very happy. I opened the car door and the dog jumped in the car and wouldn't get out.
When to come home with you?
He wanted to drive, and it took two of us to push him out.
God. Oh dear. So how do you think vets in the UK view complementary therapies like Emmett?
Some vets welcome them with open arms because they see it as complementary. So it can work alongside anything else that's going on. And if you're making a body relax, you're making the tissues perfuse easier. Any medication that the dog's getting can penetrate the tissue easier. Some vets seem to think that it's an alternative therapy and we're trying to replace veterinary care, and it's not trying to replace veterinary care at all. I've got a few vets that quite happily then refer people to me because they know that I can go and treat the dog at home or in the car park or in the field or wherever they're happy and get a decent result.
Are there any circumstances where you'd refuse to treat and refer a dog to a vet?
I wouldn't say that I would refuse, but what I would say is you need to talk to your vet first, especially if it's an acute injury. The dog can't put any weight down. If I think it's something that's neurological, or if it's something that has just happened, it's better to get the vet involved, and then I can contact the vet and say, the owners have asked me to have a look at this dog, do you mind? So it's working in conjunction with the vets.
Right, okay.
Are there any simple techniques that owners can do at home?
There are indeed. And
without giving too much away, obviously.
If I tell you, I'm going to have to kill you.
You got to get out of here first.
If there is one particular move on a dog that is crucial to the way that they can move, making them happy or making them feel more comfortable, I will teach the owner how to do that particular move.
That's as much
And
as
then
you
the
give us today,
Yeah,
honestly.
that's it. And the answer, no.
It's a bit of a cheeky question, really, to be fair.
Yeah, it is, isn't it?
Um,
Don't ask, you don't get the answer. No, anyway.
No, but like, I got a couple of clients that have got elderly dogs, so I've taught them one particular move each on that particular dog that really makes a difference. And they're really happy that they can do that every day.
it's a bit of homework for them as well.
Bit of
isn't it?
homework, yeah, and
Yeah.
they can understand what I'm
Yeah.
feeling when I'm doing a session on a dog. But it makes the dog more comfortable. The owners feel empowered that they can actually do something,
Yeah.
and then they call me in quite regularly and say, well, they need a little bit more
Yeah.
now.
Yeah. 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 Just a
It's
little
not quite
snippet.
working.
What common mistakes do owners make when interpreting their dog's movement or pain?
One of the most common one is that they just think the dog's getting older, so they just got to live with it,
Yeah.
and they ignore it
Yeah.
because we ignore things in ourselves.
Well, we do it ourselves, don't we?
Yeah,
Just
So
put it
it's
down to
just-
being old age.
Yeah, exactly.
Yeah.
And it doesn't have to be that. I mean, that's the most common.
Yeah.
Or you can just see that they've got a little bit of a limp, and they just automatically, they've got a bit of arthritis. They're getting on a bit, but actually, it could just be that they're holding a muscle differently, or they've got an injury on the opposite side of the body. So if I can go in there and help them relax the whole thing, they're more comfortable.
Yeah. Yeah. How can people tell if their dog is genuinely benefiting?
One of the most common things that owners say to me is the dog is so much happier. Some have said things like, he's had a personality transplant. He's just a different dog. The dogs get a sense of well-being afterwards. They want to play, they want to interact. And they might not have done that for quite a while if they've been injured. So the owners see a difference straight away and always report back that it's really nice to see the puppy side of the dog come out, even if they're 12, 13 years old.
Right, so let's move on to talk about red light therapy.
Yeah.
Tell me about that, how it works, and how do you combine the two that you do?
Okay. So
Or do you combine?
I know I do combine,
Right.
definitely.
Yeah.
So red light therapy, what that's aiming to do is it's aiming to go down to a cellular level. So when a muscle tissue is tight,
Yeah.
the circulation's not right, and inside each cell there's this little thing called the mitochondria. That's like the battery. So when it's tight, it can't get recharged. Red light seems to be able to penetrate all of that and then to recharge that little battery. So the cells can then expand, the cells can start moving, and the whole body then starts to relax. So there's lots of clinical evidence where they have looked at tissue underneath a microscope as they've been giving the red light, and you can actually see that the blood vessels dilate out and the lymphatics all dilate out, and movement comes much quicker. So it's really good for healing, it's good for circulation, it feels really nice because it's warm.
What sort of frequency is that in?
Oh, there are different frequencies for animals and there are different frequencies for people. So the product that I use, you basically just, for a dog, for instance, you press a trigger after you're holding it on a certain part of the body, and then it will give you a dose for 31 seconds, and then it turns itself off and you move it to the next. On people, if they're in chronic pain or they've got musculoskeletal problems, the dose is for 41 seconds. So all the different units are pre-programmed.
Right. Okay. So it's more the length of exposure rather than the strength of the red light.
And this is, and it's used. What product that I use is an LED light, not a laser.
Right. Okay.
So with a laser, there are issues around looking at it in your eyes and burning. With an LED light, there isn't. So
It's perfectly safe.
I could even have maybe a dog that has a chronic back problem or a chronic leg problem, and I could lend the owner a unit for a week, and then they could do this thing every day just to top the dog up and make them feel more comfortable.
So how long does it before they would see an improvement?
Usually it's within a few minutes. You see the dogs start to relax more, and sometimes as you're treating them, they'll move the limb out and they'll start stretching it. Yeah. And owners will say, well, they haven't done that in ages.
Are there any situations where red light therapy shouldn't be used?
On the particular type that I use with an LED light, there are no side effects.
Right, okay.
So you could use it anywhere. It's very good at post-surgical wounds, post-acute injury, inflammation, lymphatic problems. There seems to be a lot of evidence now to prove that it can be used in a wide variety of things. And we're learning things all the time.
Okay. What about, did you mention wounds? So if someone's had post-surgery
Yes.
and they've got a wound, like a dog
So-
that maybe, I don't know, has had a stick, just one example,
Yep.
dog in the shop, stick in its side and they've got a massive wound.
Yes, and you
Now-
work your way around the wound and work your way in.
Yeah.
And if you're then making the tissue relax, obviously the circulation changes and the wound will heal quicker.
Interesting.
So it's used a lot in the NHS
Yeah.
on surgical wounds because the scars are neater.
Yeah.
Interesting. Is there any misconceptions about Emmett that you'd like to clear up while you got the chance?
It's woo-woo.
It's very woo-woo.
Yeah.
It's not using firm pressure. It's not a form of massage. It's not bowing. It's completely different. And
Where does it originate? Sorry, let me just...
it originates in Australia
Right, okay.
by a chap called Ross Emmett, who is still developing things, and people travel from all over the world to be treated by him. And we've developed stuff on horses, dogs.
Why do you think it's not as popular here then? Is that because he's Australian and not British, maybe? I don't know.
It actually is more popular here than
Is
it
it?
is in
Is it
Australia.
really?
Yes,
Oh,
although in
gosh.
parts of Australia it's used within, especially in Queensland, it's used within the public healthcare system.
Right.
There are clinics within hospitals.
Yeah.
Over here there's a bigger take-up
Oh,
with
right.
complementary therapists.
Where do you think Emmett and red light therapy fits into the future of canine rehabilitation?
I think it will fit in really nicely with rehabilitation because you can go to a client's home and treat the dog where they're more comfortable, where they're not so stressed, and you can then achieve an awful lot more, and combining whatever the dog needs on that particular day.
Yeah, we know animals are always much happier in their own environment.
Yeah.
Like, you see all the stressy dogs in the waiting room of the vets, don't you? So,
Well,
yeah.
a few years ago, I used to teach this stuff all over the UK and Ireland to vets, veterinary nurses, physiotherapists, massage therapists, and there are a couple of vets now that have changed the way that they do things, and they actually treat dogs at home. So they leave their clinic early, and on the way home, they stop off and treat the dogs, and they get different results.
Yeah, I think it's important. That's the part that a lot of people they forget about, don't they? That actually, if you take the animal out and keep it in its own environment, the stress immediately is reduced, isn't it?
Yes.
But you then take it into that alien environment where they associate it with pain, stress. The animal is automatically it's on a different level before, and then add in the pain that they may be in. It's
a lot of dogs and cats do not particularly like going to the vets. They associate the vets with being
bad times.
bad times, being poked and prodded and
unless
stabbed.
you're Womble or Frank who loves the vets.
Yeah.
and
My
just-
dog loves the vets. He
You know.
looks in ahead of me.
Yeah. Frank used to be
But
evicted.
we've had others that have been like,
absolutely
Yeah.
terrified,
Yeah,
and for
so-
no reason.
No,
nothing's ever happened to them, but they're just terrified.
And I've, with some of the vets that I've taught in the past and veterinary nurses, if they get a dog that's coming in that's anxious, the vet will go out and do a couple of bits on the dog in the car park, and then the dog calms down and goes in quite nicely.
Yeah, that's quite good.
unless
It's nice, isn't
unless
it?
you're Lulu, then
Yeah.
still, even that didn't work, that trick.
No, no. And when you say to the vet, "Don't turn your back on the dog," flying.
what it
And they
means.
don't believe you.
No. The next thing, you needed them fingers, did you?
So if listeners remember one thing from today's conversation, what should it be?
I'm a lovely person.
He brings cake.
He brings
Bring-
cake.
Well,
bring
I
ca-
shouldn't perhaps say that because now every person that books an appointment
He's expecting cake.
bought me cake today. I'd like to point this out. Yes, he bought me cake.
I'm not baking it.
No, that's the only drawback. He doesn't bake cake, which is a bit rubbish. I have to say that.
From today, it's that I could possibly go into people's houses or meet them on the yard or wherever a dog is comfortable and help them make their dog more comfortable and improve its quality of life by using a technique that is non-invasive, works with the body, and then I get a new best friend.
But not just dogs.
Not just dogs, horses, cattle, cats, pigs, llamas.
Humans?
Oh, humans.
Alpacas.
Alpacas. And sometimes it's really interesting that you can see the dog and the owner actually mirroring each other the way that they stand. Right. And you can start treating one and the other one starts moving.
Yeah. I thought he was going to say their appearance, mirroring appearance. The owner's like, all right, go on then. Which one of us, come on, well, we're here. Which one of us is which? We've put him on the spot now, haven't we? Which one's Womble, which one's Fidget?
Oh, you've got to be Womble.
I'll take the Fidget.
So we've talked about dogs and horses. I mean, what about cats, birds? What other animals have you treated?
Cats, definitely. Well, cats.
Are they more difficult to treat than?
No, they just give you a certain look to dismiss.
Cats do that anyway.
That's it. Well, ours do.
You can. There's a certain house that I go to, and they've got 2 cats and 2 dogs. Sometimes they won't have seen the cats for a couple of days, and within 5 minutes of me being there to try and treat a dog, the cats come in and they push the dog out the way, and then I do whatever the cat needs, and then they give me this look of dismissing me. You can go now.
Yeah, cats have staff, don't they?
Yeah.
Do you want a cat?
I've got a very nice cat you can have if you want.
Very nice Persian. He might like you. And what other animals have you treated?
Cows. There's a lot of farmers these days that are turning to things like homeopathy.
Yeah, it's become more popular, hasn't it?
Much more popular, and it's great that they are looking at complementary ways to treat their animals. They know their livestock inside out, and they can spot something a mile off. And there's a couple of farms that I go to treat the cattle, and if I walk into a paddock or if I walk into a barn, the girls look at me and they all come trotting over. and I've got some videos of me treating cows where they just literally stand there. You don't have to hold them still or do anything, and they show you what to do. It's quite good fun.
Yeah, I can imagine.
I treated a parrot. He was stressed and he was plucking his feathers out, and he had been seen by a couple of vets that tried to calm the parrot down, and he'd bitten the vets. And I just went in there and did some bits and pieces, and he was much happier. And then the second time that I went to see him, he wolf whistled at me.
Oh, did he?
Some of my colleagues have treated camels, elephants.
Camels not nice though, are they? They smell. Oh no, they smell, don't they?
They do.
They do. We can vouch for that, don't we?
Literally any sort of.
Is there any animal that you're frightened of?
Spiders.
Oh.
I can't say I'd ever see you treat a spider, to be fair.
I did treat a tortoise.
Did you? What was wrong with the tortoise then?
So the tortoise, it was part of the 100th birthday celebrations for the tortoise. It lives in a rescue centre.
Right.
And they asked for some publicity shots because they were going to do lots of things to celebrate Churchill's birthday. And so they gave me the tortoise, and I was working through. The shells are really sensitive, barely touching, and you saw the tortoise change.
So apart from spiders, then that's it really. You treat pretty much anything.
I'd have a go at treating anything. I haven't done a fish either.
So is there any particular animals that you've treated you can give us examples of?
There was one which was a lovely Great Dane called Jake, and he'd got a neurological problem, and so when he was walking along, he would then fall over. And he lost his confidence, and he was very anxious about things. And because of his size, it would take 2 people to pick him up and try and get him to walk.
It's not the animal that you want falling over, is it, particularly?
No, it's not at all. And so when he was given the diagnosis of his neurological problem, he was told, or his owners were told, that he wouldn't last much longer. And I started going in to see him every few weeks and do some bits and pieces on him, and he lasted.
So when you say bits and pieces, what did you do?
I was relaxing his back. I was helping him feel more comfortable, and literally just.
What was his actual problem?
So Great Danes get a neurological problem where from the back of the ribs down, they get a muscle wastage really quickly.
Right.
They can get a loss of sensation, and as they're walking along, literally, their back end just goes completely. It's quite common.
Yeah.
And with Jake, I would go in and I would treat his back, I would treat his spine, and he would sit there and he was sitting there like Lord Muck. When I walked into the room or into the garden, he'd say, where have you been? But he lasted another 18 months with a really good quality of life. And his last weekend with us all, I was sitting in the garden treating him under his little gazebo that he had. So he was nice and comfortable.
Yeah.
And then all the family turned up and we all just sat around him having a nice time, and 2 days later he passed.
Nice weekend.
Oh, it was a lovely last weekend, but it was a really nice memory for all of the family as well.
Yeah. I think that's important, isn't it? Because a lot of people witness their dogs suffer, and the end is if you can make it more comfortable for the dog, then it becomes more comfortable for the owner, even though the emotional side of it is just painful for them.
Yeah, because some owners will feel guilty that they couldn't the dog was in
and they can't fix them,
and they can't fix it, they can't do anything about it, and they wish that they could. So sometimes I'll go in and just help them feel more comfortable. So he was lovely, and he had another 18 months where all of the family had time to say goodbye. And I've got another dog that has quite bad arthritis in his hips, and the family were noticing that every time that he got up he was limping, and he didn't want to put pressure onto one foot. And I've been using just red light on him, and now he's walking 3 miles a day.
Oh, brilliant. Gosh.
And he's on hardly any medication,
Oh,
so
that's
medication is hard as well.
How old is he?
10.
Oh, wow.
Okay.
But he's had quite a rough life. He's a Bulgarian Shepherd.
Oh, right. So he's quite a large breed.
Quite a large breed.
So he's quite advanced in years.
Comes from a rescue background, so he didn't have a very good start in life. So he was malnourished for the first couple of years. So, but he's now much happier, moving around and walking, say 3 miles a day, which you couldn't do before.
Oh, that's lovely though, that is, isn't it?
So that's the sort of thing that's quite nice. I had a horse recently who had been to quite a prestigious show, got spooked at the show, and then was quite visibly lame. The horse was assessed by a couple of vets, and they couldn't quite work out what was wrong, but he could hardly walk. Got the horse home. The local vet came out and said, I've got no idea what's going on. We need to do a lot of further investigations into this. And the owner said, I've heard of this man that does this weird therapy that seems to help relax. It's all a bit woo-woo, yeah. And so I got a call to go and treat this horse. And the vet said that she'd be intrigued to find out what was going on. And there were some issues in the horse's hips. And I sorted those out, and 2 days later they were out hacking and couldn't find anything wrong with the horse. And the vet just laughed and said, I don't believe this.
Yeah. The problem is, I think, it's really difficult to explain to people, isn't it, how things work. And that is, unless you see it for yourself, you can
talk about it until you're blue in the face, and you can, I've written articles, I've had stuff published.
Oh, because you've written a book as well, haven't you? Yes.
I've written a book about my story into complementary therapies, and how that helped me personally, because I had worked in the NHS as a clinical nurse specialist in intensive care for over 20 years, which is very invasive. You're putting people onto life support machines, they're unconscious. Various, and then when you're in that environment, you think that's the only thing that could work. That's
the normal.
Tree huggers, leave them to one side, and I turned into a tree hugger. And here
you are. Why our trees have got marks on them everywhere.
Is your book available?
My book is available on Amazon.
Right. Okay. Title?
Goodbye to Pain.
By Tony Sherry.
It's my story of why I got into it. So hopefully when people read it, it gives them another opportunity to think that what they may have been told by doctors is not
necessarily
Maybe some hope as well.
The all.
The
Yeah.
all,
Some
be
hope,
all and end
don't you
all.
think?
But
That's
there
it.
might be other things that are out there that
So I
help
think
them.
everyone needs a bit of hope at times as well.
We all
especially when
respond
you're
differently.
when you're in that sort of situation that there is nowhere, you don't really know where you're going to go with pain, whether it be yourself, an animal.
Yeah.
You know, you actually despair of what can I do? You know,
Yeah.
you do need that, even that woo woo.
When you're in pain 24 hours a day, it affects your mental health. Same with the dog. And some owners say, because I will quite often ask an owner, describe the dog's personality to me. And some people will say, on a Tuesday he'll eat fish, and on a Thursday he likes this, and they know their dog inside out. And there are others that say, well, he's a dog. So I know how to pitch my conversation with them in that sort of circumstance as well. But quite often they'll say things like, oh, he's turned into the doggy version of Victor Meldrew. Yeah. Well, the reason is, and then we'll do something, and then they say he's had a personality transplant.
Yeah.
That's job satisfaction.
It's more the case that it's gone back to being how it was before it's pre-pain.
Yeah.
So.
And we can obviously speak from experience because you have treated some of our dogs, and I must admit, probably the remarkablest one is Womble. When we, those of you know us, know we've had various bulldogs over the years, and Womble, the boxer we have now, has never been on his own. And obviously, we lost 2 bulldogs, so we lost our old cranky matriarch first. She was old, that's expected. But Frank suddenly dropped down dead. And even though Womble was there, he saw it happen. He saw Frank afterwards. We laid him there. He didn't want to go anywhere near him, did he? He was just... No. And then he completely withdrew. And now Womble is the dog that is in everyone's face. As you know, he's there.
He's totally changed overnight, didn't he?
He didn't eat. No. He wouldn't come out from under the desk. He didn't come out and say hello to anyone, which is so unusual because he's the first one out, standing up going, hello, I'm here. Whether you like dogs or not. So obviously we spoke to you, didn't we? And you came to see Womble, and perhaps you can explain, although Womble wasn't limping, it was emotional with Womble. Yes. And people say to me, oh, dogs don't grieve. Trust me, they do.
No, they do grieve,
that frustrates me because I think, no, you should have seen my boxer, trust me, because for 2 weeks, that dog, it was just awful. We just didn't know what to do with him.
I think sometimes people don't want to see that the dog is grieving.
Yeah.
But they do grieve.
They do.
Quite openly, and so I can go in there and I can tailor make a treatment to make it an emotional treatment. There are key muscles in anybody's body that hold on to emotion, and if you've been through a traumatic experience, I can then help release that.
So in a dog, where would they be? Those areas?
They can be just inside the groin. And they're also then some of the core muscles as well. So the core deepest muscles in the body has a nickname. It's just the muscle of the soul.
Oh, right, okay.
So in people, it's the muscle that puts us into that fetal position when we're really frightened. And it all shortens up. But it also has lots of other influences in different parts of the body, in the lower back and the hips. If you can go in there and you can release that and make that relax, everything goes back to normal. And it doesn't take that long. And there are certain things that I can show an owner how to do to bring a dog's anxiety levels down. So if, for instance, they are going into a situation that they know is going to be quite anxiety provoking for the dog, they can do some bits and pieces on it before, and as they get there, and because you have done it beforehand, the dog's subconscious says, oh, I know what to do now.
So you must have some good moves for fireworks.
Oh yeah.
It's a very stressful. Some animals are very stressful.
It's a really stressful time. So those dogs that are prone to being frightened of thunderstorms and fireworks and things like that, then I'll show owners a little sequence of things to do. And you can do it on a dog when they are normally relaxed, but they relax at a deeper level.
Right.
And you're talking to the subconscious. So as the stuff's building up, like the fireworks are starting, or we're getting anxious because we know that the fireworks are going to be starting in a little while. Dogs will pick all that up.
Oh, they do.
They pick up on us, don't they?
Yeah. So then if you start doing this thing that you've done on them before...
Would that be the same process for cats and for horses, livestock? Because obviously we forget that they do also suffer extremely.
You could be a busy person, come fireworks
You could.
season.
You could clone
Sometimes
yourself.
I am. But if I can do things and I can help the owners do things for their own
Yeah.
dog,
Yeah.
everybody's a winner.
Absolutely.
So this information is all out there on the internet. So I just share it in the right way at the right time, empowering people, empowering
That's how it should
owners,
be.
and making the dogs and the owners feel comfortable. Because if the owner's starting to feel comfortable, that will impact on the dog.
Well, thank you for coming and talking to us today, Tony, and thank you for the cake. Very kind of you.
Lemon drizzle.
Yeah, I know. If you book Tony, please insist on you get cake. So if you want to, before you go, just tell everyone how they can contact you, via social media, wherever,
So I'm on social media as Tony Sherry, and my website is www.tonysherry.com.
Okay, and what sort of areas do you travel to?
I travel all over the southeast of England.
Okay, so that gives a wide area to cover.
It is a wide area, but I get referrals from all over the place, and I have been to other countries to treat animals as well. So I go all over the south of England quite happily.
Fabulous. And is there anything else you want to add in before you go? Anything you want to say?
Thank you for having me in the paw
Fabulous.
store too.
Oh, yes. Tony, yes, we forgot about that. So you can find Tony in our shop in Lingfield, the paw store. He's a regular feature. Is that the right word?
Piece of
He's a
furniture.
feature.
Was it the second Saturday of every month, isn't it?
So quite often
You
twice a
can
month.
check our Facebook pages. We do.
Yeah, you can see it.
We
but
do
yeah.
advertise.
No, I apologise. You're not a feature, are you? Tony's the pick and mix stand. No, it's not. But yeah, so Tony's quite often in, and and to be fair to him, I will say that people come in and Tony's forever doing things and and helping people, and he doesn't actually charge, and so.
No.
Whereas you should really do at some point, Tony. You might have
I
to
won't
earn
be a
a living.
millionaire.
No, he's never going to be a bit like us. You're never going to be a millionaire, sorry, because you're doing it for the love more. So
It's the look on the dog's face, and then and then the owner's face when they see the dog moving, and the dog's change.
And everyone's happy.
Exactly.
I think one of the funniest things is when they always say to me, "How does he do it?" I'm like, "Well."
I think that's the hardest thing is trying to explain
it. Yeah. I mean, I think
because
that
as
is
you
the
say,
hardest
it's woo woo.
Yeah.
I have that problem when I try and
But it's
refer people to you. That I have to try and to explain what you do, and it doesn't doesn't come across the best.
But it's also about how, as a therapist or anybody that's interacting with an animal, how you present yourself.
Absolutely, yeah.
I had to go and treat a dog a few weeks ago who was a rescue dog. He was a street dog in Spain. He'd been to a rescue centre, been fostered out twice, bitten lots of people, and then I was asked to go and treat him.
Yeah.
And then as I got there, they said, he doesn't like men.
Thanks for that.
So I literally walked in and I sat on the couch, and the dog then came in the room and he jumped on the couch beside me, put his head on my shoulder and started licking my face.
Oh,
And
gosh.
he's been my best friend ever since.
Yeah.
It's just,
Yeah.
They pick up on it, don't
they do pick up on it.
And I think it's easier. So I know when I've seen you, people come into the shop and you try and explain it to them by actually standing there and touching. I don't know what
Treating
it is,
the
but then
owners.
you see people swaying, not because they're drunk, but because Tony, I don't know.
Well, to be fair, I mean, Tony's treated my shoulder, and you do notice the difference.
Yeah. You do.
But it's very even. I've had it done. It's still very hard for me to explain to people actually what goes on.
Yeah.
The lighter the pressure on the skin, the quicker the effect goes to the brain.
Yeah.
And if you're talking to the subconscious, it then says, okay, I can relax now. Whereas if you're going in with firm pressure, the body clams up.
Yeah.
So, light pressure.
No. There's nothing worse than a sports massage.
No,
when you don't know.
no. I did have a lady.
Well, they are quite nice for the first 5 minutes.
No. Do you remember that one we had? And I come out, I was absolutely black and blue afterwards.
Yeah.
Honestly, there's
She's
nothing off
shouting
me.
that split halfway through.
I was like, this is supposed to be nice and relaxing. And I'm like, for God's sake, please stop.
I was treating a lady that had quite bad issues post mastectomy, and I was treating her, and her granddaughter came in. Granddaughter's early 20s, and she said, "What are you doing?" And grandmother just said, "Oh, it's this light pressure technique." And the granddaughter said, "Well, a load of rubbish. That can't work." And I said, "Why is that?" "Well, I've got a shoulder injury from a car crash, and when it's bad, my mum's, she's a massage therapist, she's the only one that could release it. And I said, well, that's nice. How does she do that? She gets the handle of a wooden spoon and prises it underneath my shoulder blade and lifts it up. And I said, doesn't that hurt? She said, yeah, and it bruises. But once the bruises have gone, it feels lovely.
So much better.
And
Oh, God. Don't try this at home.
I said, let me do something. And I demonstrated by doing something on her shoulders. And she just literally dropped to the floor. And she went, I can't believe it. Wait till I see my mother.
She burnt that spoon. That spoon's in the fire now. Gosh. Well, it's been lovely speaking to you, Tony, as
Thank you.
always. And like I say, he's a regular feature in our shop. A regular visitor. And I do hope, everyone has a better understanding now. And we've tried to help, or
Thank
probably not help.
Yeah,
I don't know.
Yeah.
And anyone's got any questions or anything, feel free to drop Tony a message.
Please.
Well, thank you once again, Tony.
Thank you.
Thank you both.
Yeah, and goodbye from us.